All right, now this is where we get into, the depth of your experience. So you've been working with patients many over years. So if you would help our audience try to understand what you see in terms of therapeutic velocity, how fast does LiveO2 work compared to Hyperbaric, how many patients have you worked with, et cetera, because I think that's an important experience.
Yeah, I have worked with hundreds, if not by now thousands of patients with the system that I use. I can tell you, nobody has been harmed by oxygen. Everybody has been helped. Now, you mentioned the difference between, why don't I use hyperbarics? As well, because I can do in 15 minutes what it takes an hour and a half to do in a hyperbaric chamber. So it's effective in terms of how many people I can treat in the course of a day. It is far less expensive. If I was going to do hyperbarics, I'd have to have a hard-sided chamber. I just wouldn't settle for anything less, which means that I've got to have somewhere upwards of $50,000 for the initial investment. Plus, I've got to have a full-time person to run the chamber that has to be trained in hyperbarics and management, that I'm only going to be able to do maybe 8 people a day. Not inconsequential, but far from cost effective. I have 2 of the 20-liter altitude contrast 2-person setups. I have 1 person that we have trained to run the exercise in 15-minute increments, and even allowing time to do vital signs and explain the other stuff that we do along with the LiveO2. I can realistically do 4 times that number in any given day. I can do 20, 30 people a day. How many more people am I helping? How much more cost effective is it? We're looking at a 40%, 40% or 60% off the cost of a used hard-sided chamber for a complete LiveO2 system, with extra left over to buy some extra masks. Some people prefer a treadmill. I have a treadmill. I have a couple of bikes. Bikes don't cost me anything other than the cost of the bike because it's self-powered. A little bit of electricity it costs me for the treadmill is not much. And then for the oxygen concentrators, it's just far, far, far more cost effective. And it works.